care and his compassion. When I would go through miscarriages, I knew before he ever told me. He'd walk in the room with tears coming down his face, and would walk over and give me a hug. There is just a level way above what you would normally have with just a doctor-patient relationship, just of how much he cares. In the beginning, he really took the time to just get to know me and who I was as a person. And there were some miscarriages along the way that he went through with me. Then he delivered my first daughter, who just turned 30 a couple weeks ago. Had gotten married. She had started going to him as her doctor. He had said to her, "I'm going to be retiring, so if you want me to deliver your baby, you have to be pregnant by a certain time."
He told me that this would be the last year that he'd be delivering babies, which we weren't planning on starting our family right at that time. So it was definitely disappointing to find out that news. And it made it that much more exciting when we did get the surprise that we were expecting, because we knew that we would be able to have him be our doctor.
She had some complications, and we walked a scary road for a while. When you go through situations like that, you're already scared and you're fearful of what the outcome could be. But knowing that you're in the best hands possible, it just took the edge off of that, of just knowing that he would take care of her no matter what happened. She was in the best hands.
And every time he comes in the room, he gives you a hug.
Yeah.
So just in all of his body language and his demeanor, he always shows that he really cares. And I did remember too, we kind of had a joke going with us being his last delivery that he saved the best for last.
Yes.
And I know that he cares for all of his patients, so it was never anything obviously against that, but I think just showed that it was just as special to him as it was to us. So that was kind of neat.
Methodist has done so much for me through the years, from the time that my daughter was born, to my daughters being there for different surgeries, to the new women's hospital and delivering my grandchild. There's just an array of where Methodist and different doctors and nurses and staff have been there for me, and I've just always wanted to make it a point to give back. Just to be there for those moms like people were there for me. So helping in the NICU if that is needed, helping with the high-risk moms. I had 3 high-risk pregnancies. Being on that floor to help them and to just be that listening ear for them, or to wash their laundry, or just do whatever they need to know that they've got someone there for them and to support them.